Sex reassignment surgery, also has a name preferred by transgender people, gender confirmation surgery, is a surgical procedure by which a transgender person's physical appearance and function of their existing sexual characteristic are altered to resemble the socially associated with their identified gender. Gender dysphoria refers to clinically significant distress that some gender-diverse people experience because of the incongruence between their gender identity and the sex at birth. It is important to note that for adolescents with gender dysphoria, hormone receptor blockers are the primary tool, while the surgical intervention is deferred until the individual reaches the age of 16 or 18. Throughout the world, gender reassignment surgery has been in development for a century. The first incomplete female-to-male sex change operation was reported in Berlin in 1918 by a Viennese doctor. Over the next 20 years or so, early forms of sex reassignment surgery began to be performed in Europe, but these were immature and often involved simply removing the reproductive organs from the recipient's body. In 1965, in the United States, gender reassignment surgery was licensed by the courts, marking the beginning of the legalization of gender reassignment surgery in the United States. In 2017, the China Healthy Commission further regulated the clinical application of gender reset technology to ensure the medical quality and the medical safety.
Sex reassignment surgery include feminization surgery and masculinization surgeries. Feminization surgeries include vaginoplasty, augmentations, mammoplasty, orchiectomy, and so on. Vaginoplasty represents the cornerstone of sex reassignment surgery in male to female patients, and an increasing number of patients have decided to undergo this surgical procedure over the years. But it is also the most complex technique for patients. Although no vaginoplasty technique has proved to be the gold standard, the most commonly used technique involves the utilization of inverted pinouts and squatted flap for neovagina in neovalve formation. First, the anterior parts of the perineum is inside. Then cause fascia is dissected of laterally to expose the urogenital diaphragms. The central tendon of the perineum and the muscular fascia structures are dissected. These dissections create a virtual space in the ischiorectal fossa, which will accommodate the neovagina. Masculinization surgeries include top surgery, mediadioplasty, phalloplasty, and so on. Phalloplasty is considered the most significant surgical procedure in the masculinization process. The goal is to create a neophallus that successfully achieves both cosmetic objective and the functionality of a phallus. The development of phalloplasty has evolved over decades. The most commonly flap used was the radical forearm free flap. Other techniques are not widely used in view of the few successful cases. Radical forearm free flap design integrates the constructions of the neo-urethra into the creations of the neophallus. A section of the flap creates the neo-urethra while the remainder of the flap rests along it, creating a tube within a tube.
After a long period of development, sex reassignment surgery has been gradually improved. According to the 2019 plastic surgery statistics by the American Society of Plastic Surgeons, around 11,000 gender confirmation or sex reassignment surgeries were performed in the U.S., which was around 10% to 15% higher than the previous years. As a country that performs the most sex reassignment surgeries, Thailand attracts nearly 20 million people to the country for surgery each year. However, the data shows that most transgender people do not undergo gender reassignment surgery. According to the 2017 China Transgender Community Survival Status Survey report, 51% transgender people have the need for sex reassignment surgery, but only 14.8% of transgender people have had gender reassignment surgery. As many as 89.1% of transgender people who needed gender reassignment surgery are unable to have the surgery, and prohibitive costs and long waiting lists will be the main reasons. Compared with surgery, hormone therapy is more popular and easy to access. The administration of hormones facilitates the development of secondary sex characteristics as part of a medical transition process, and hormonal therapies improve quality of life and mental health with minimal adverse effects. Hormone therapy for transgender individuals has been shown in medical literature to be generally safe. 62% of respondents have had hormone therapy, and an additional 23% hope to have it in the future.
Changing perceptions of transgender people in popular culture, academia, and science. This is especially true as we become more aware, understanding, and open to transgender people. So let's talk about what the effect of gender transition on transgender well-being. Firstly, the scholarly literature makes clear that gender transition is effective in treating gender dysphoria and can significantly improve the well-being of transgender individuals. Also, among the positive outcomes of gender transitions and related medical treatments for transgender individuals are improved quality of life, greater relationship gratification, higher self-esteem and confidence, and reductions in anxiety, depression, suicidality, and substance use. Furthermore, the positive impact of gender transition on transgender well-being has grown considerably in recent years, as both surgical techniques and social support have improved. Meanwhile, Pulling data from numerous studies demonstrates a regret rate ranging from 0.3% to 3.8%. Regrets are most likely to result from a lack of social support after transition or poor surgical outcomes using older techniques.
I just lived my life as a woman for 2 years. It was difficult. There was a lot of abuse and everything else.
However, transgender individuals, particularly those who cannot access treatment for gender dysphoria or who encounter unsupportive social environments, are more likely than the general population to experience health challenges such as depression, anxiety, suicidality, and minority stress.
Today, people are more aware and concerned about gender issues. Hence, the perception and expression of gender has initially evolved from a purely binary classification to a continuum of masculinity and femininity. Sex reassignment surgery is undoubtedly a major progressive practice, but then, a comprehensive gender-confirming surgery is not only about the transformation of sexual organs. Nowadays, specialists are dedicated to improving this from the following aspects. First is the more delicate carving. For example, scientists and doctors are already studying the differences between male and female microfacial features, such as soft tissue, muscle tissue, and bone development, bone mass. The future also includes surgery for nerve sensitization and beautification of the genitals. Currently, the professional doctors in this field are far from enough. Discussions of transgender issues have always been inseparable from the employment discrimination faced by transgender people, the psychological and physical rehabilitation, and the financial problems. We are here talking mainly about SRS. We paid much attention to the gender characteristics of people. Of course, science should search for helping these people through technologies. But when we face them, gender characteristics and appearance are the least thing we should focus on. Their inner expressions deserve more recognition and support, just like everyone else. And one day, just hoping the word transgender won't bring any strange vision, and they can live normally, just as male or female.